Hi, everyone. It's 12 p.m., so we'll go ahead and get started. Welcome to the fourth day of Lunch with Links. My name is Rosemary. I'm the COVID-19 training coordinator for the immunizations program. If everyone can mute their mics, please. Thank you. Joining me from the Links team today is Judy Green and Katie Lee. They will be presenting on vaccine management and accountability in Links. This presentation will be recorded and later posted on the Links website, lalinks.org, under the Links Training Videos button. All previous Lunch with Links videos have been added and are available to view. During the presentation, please type any questions you may have in the chat box. There will be a Q&A session following the training where all questions will be addressed. I will now turn it over to Judy to start the training.
Good afternoon, everyone. Glad you could join us today. Today, we're going to talk about our controlling our vaccine inventory in Links and the several ways that we can do this. And to begin with, I will remind each of you that were maybe on the previous days that the most important thing you can do when you log into Links is make sure that you have your vaccine inventory posted in your inventory as you should, and you've received it through. Today, I'm going to work with the Burnham Parish Health Unit because they have just a couple of little areas that I can show you how their inventory doesn't seem to be as correct as it should be. So what they're going to do is they're going to check their inventory this morning, and they're going to check their COVID vaccine. So that once they log in, they're going to go down to
Judy, you have to share your screen.
Oh, I'm sorry. Oh, I'm so sorry. Excuse me.
There we go.
Okay. That'll be better, huh? Pardon. So once they go in, they're going to go down to their lot numbers, reconciliation page. And it will bring up all the inventory that they have in their system at this time. We're dealing with COVID vaccine, and so today, where they're checking their COVID vaccine, and it shows for one of the lots, they have 61 doses, 79, 100, and 100. But when they go to count their vaccine in their refrigerator, they notice that this lot 012A, they actually only have 59 doses instead of the 61. So what they have to do is they have to figure out what happened to those other 2 doses and why didn't they decrement their inventory. So there's several ways that you can do that. The first way, and the first thing that you should do, is you go over to your reports menu, and everybody has access to the report menu right here under reports, and you want to go to report module. Oh, that didn't sound too good, did it? And I believe my internet just went down. Katie, I may have to depend on you. Hold on, I think it's coming back up. That really doesn't help. Okay, let's try this again. I think I'm back up now. Okay, so we'll go back over. We've looked at our inventory, and we see that we're 2 doses short on one of our lots of our COVID vaccine. So we're going to go back over to our menu. Pardon?
We don't see your screen.
Oh, I'm sorry. Let me see if I can get it back up again. Can you see it now?
Yes, ma'am.
Okay, I'm sorry. So we're going over to our reports menu on the left. Under it, we're going to go to report module, and this will give us all types of reports that we can run through our system. The 2 reports that we usually deal with for missing doses in our inventory are under patients, and it's called the patient detail report. And under vaccinations, we have what we call a lot usage and recall report. The first report I'm going to run is I'm going to run a patient detail report. And I want to key in on this particular lot number. So what I'm going to do is I've come in here and you see I've logged in as the Vernon Parish Health Unit. It's all in there for me. The one thing that we want to remember to do is we want to run this report by service, because we just want to see the vaccines that we administered in our health unit and not, or in our facility, not necessarily those that are our patients, but they might have gone to a drugstore or elsewhere and got their vaccine. So we want to run this report by service. We want to be sure we have our organization and our facility selected. We're going to go down to where it says inactive status at the organization level, and we're going to see it says active patients. We want to look at active and inactive patients, just in case one of our patients didn't get activated for some reason. It will still show up in our report. And then we're going to go down, and if we're just looking for one lot number, we can actually key that lot number in, or we can select it from a list. And as you see right here, I have this COVID vaccine 012A21A that's listed. So that's the one that I'm 2 doses of, so that's really the one I want to look at. Then I go down, and I have a choice here. I can either show all the vaccines under doses decremented, all the vaccines that were given. I can show just the ones that decremented, or I can show just the ones that did not decrement from my inventory. And what I'm looking for is the problem with trying to find these 2 doses that did not decrement. So I'm going to select the non-decremented doses. Now you can run these reports a couple of different ways. You can just create a report and it will bring it up for you, but I always use the export report because it'll bring it up to you in a spreadsheet that it's a lot easier to deal with. So we're going to export this report to see which of my vaccines are in there that did not decrement my inventory. And when we see it come up at the bottom here, our patient detail report, it's going to come up and it's going to show me 2 patients that I have that are showing that they did not decrement from my inventory on this particular day with this particular lot number. So we're looking at the patients are here. It'll have their name, their birth date, their phone number, the facility, the vaccine. And if you look right here, it's going to tell you if the vaccine's decremented or not. And right here it says, no, they did not decrement. Why did they not decrement? You don't see a manufacturer code. You don't see a lot number. You don't see a funding source. And it shows that these 2 patients were put in as historical instead of being put in as administered vaccines. So right there, that gives you the key as to why these 2 doses did not decrement. So we're going to look back at this patient's information where they signed whatever they signed, and it's probably going to show me that they actually got this dose of vaccine, but we probably got in a hurry or something, and it ended up that instead of having this vaccine entered as it should be as administered, it was entered as historical, so that's why it didn't decrement. We can really go into the patient record. You can go, and I'm not going to because it has patient information there, but you can go into the patient record as I've shown you before and actually edit that patient's record and change that historical to administered, select the lot number, save it, submit your changes, and then it will come off of this report and it will decrement your inventory and your inventory will be correct. The other report we can run is we can run what we call a lot usage and recall report. And this report can be run for several different reasons. You may have a lot number that you gave to a patient. Let's say the recall that lot number. You can run this report to see all the patients that got this lot number so that you'll have a way of recalling these patients. But you can also use this to try to find out why our patients did not decrement. If you run this report, if your patients decremented from the inventory, they are going to appear on this report. So I'm going to run this lot usage and recall report for this particular lot number. And I'm going to go down here and I'm going to find this lot number, which is this one right here. I'm going to move it over to my selected box. And I'm going to come down here and I'm simply going to create this report. And when I create this report, it's going to give me a listing of all the patients in my facility that received this lot number of vaccine, and it decremented the inventory. And as you see right here that I've got a total of 139 patients, it will give you a total and 139 vaccines administered. But I'm still those 2 doses short because I actually administered 141 doses. And my 2 patients that came up on my other report for not decremented are not showing up on this report because their vaccine didn't decrement from the inventory. And those are the 2 reports that you can work with to try and help you find your vaccines that did not decrement from your inventory. And that's basically how we look and try to correct our inventory. Katie, did you have anything to add?
Nothing to add.
Any questions now?
Okay, so the first question we have is, what was the name of the second report again?
The second report we ran is called, let me find it for you again. I'll highlight it because I have it keyed in on here so I didn't. It's called the Lot Usage and Recall Report, and it's under your report module.
So we can start taking questions. So if anyone has any, you can type it into the chat box, raise your hand, or unmute yourself.
Okay?
Doesn't look like anyone has any questions.
Looks like everybody has probably had to use this report at one time or another.
I have a question.
Okay?
Just two questions rather. The word decrement is new to me, and that must mean subtract, huh, or remove?
That's correct. It means it takes it out of your inventory. Every time you administer a dose of vaccine to a patient and put it in their vaccine, put it on their record as an administered vaccine, it's going to take a dose of that vaccine out of your inventory.
Okay, second question. I did 50 doses yesterday.
Yes, ma'am.
And I'm trying, and there was an extra dose that we had, a 51st dose. I put that in manually. However, when I look to do the same report, lot uses, I get nobody. They tell me no report. And I put yesterday's date in for the starting and the ending date. Why wouldn't I have been able to see who I'd given the vaccine to so I could match it with my log sheet?
You should have been able to see so, and I'll tell you what, if you will, if you will put my email address in the chat box, if you will send me an email as soon as we get off this call with your contact information so I can give you a call, I will go over it with you and we'll look at it.
Okay. Okay, that's very good. Thank you. Because
I certainly will.
I used to have ability to, as a manager, I used to have the ability to do that. And on yesterday, when we were trying to determine whether that one report, we were down to 2, and we were trying to determine what 2 we hadn't put in. I couldn't pull the report, to try to let me know.
Okay. Yeah, if you'll just, you send me an email with your contact information and the name of your facility, and as soon as we get off this call, I'll give you a call.
Okay. Well, provide that for me, and I'll do that.
All right.
Thank you. Mm-hmm.
And that's actually for any of you. When Katie puts my email address in the chat, if any of you have any questions, feel free to email me, and If you feel like you need to speak with us to go over something with you, if you just give us your contact information, I'll be glad to call you. If that's all, I don't have
No.
anything else.
Yeah, I just got one more question. When
Yes,
I did
ma'am.
look at the report, we had more than one type of COVID. Does it matter? Or it's just gonna capture, if I'm looking to see who got the COVID, it's just gonna capture the COVID by the
The type of COVID it is.
yeah,
Yeah,
by the
you
type
can
and by the
either
amount?
you can either select the COVID vaccine, the particular lot number that you're looking for, or you can just select, like if I run reports all week long on different regions trying to help them find which ones maybe didn't decrement and what site. And a lot of times I'll just run the report on all of the Moderna vaccine, even though a lot of people will have several different lot numbers. So you can run it on just the vaccine, or you can run it on just a lot number.
Yeah, okay, I got you.
Okay.
Okay, we have a question. Can you repeat what lot number should be recorded? The lot number on the box or the syringe?
The lot number on the box is always the lot number that you use. And as we did yesterday, we went over, are all of you familiar with how to find your expiration date for the Moderna and the Johnson & Johnson vaccine? Because it will not, Johnson & Johnson will not be on your box. And the Moderna vaccine, the lot number that's on there is usually not correct.
I'll type those links into the chat box so that everyone has them.
Okay, thank you.
Okay, next question. If we have some discrepancies, should we contact our regional director, or is there someone else I should contact? I have several issues that I need resolved.
Yeah, you should contact your regional director and they'll be glad to assist you. If they're unable, a lot of them are out right now working with the COVID strike team. So if you're really having a hard time getting in touch with them, their email address is on the homepage of link. You can always send us an email and we will get in touch with them, or we will call you and help you ourselves. We'll always have someone that can assist you. Anything else? Okay. I think that does it, Brooke.
Thank you everyone for attending today's training. Tomorrow's training will be on reports and links for anyone else who is interested. For a complete list, that's the last one. So no more trainings after tomorrow. For any links related questions, you can email la.links@la.gov. Thank you.